Hello everyone, and welcome to today's lecture on Selective Serotonin Reuptake Inhibitors, or SSRIs. This session is designed to give you a comprehensive understanding of SSRIs, covering their history, mechanism of action, clinical indications, evidence supporting and challenging their use, adverse effects, contraindications, and specific details about individual SSRIs, including the dosing and side effect profiles. By the end of this lecture, you should have a solid grasp of SSRIs and be able to apply this knowledge in clinical practice. Let's begin by defining what SSRIs are. Selective serotonin reuptake inhibitors are a class of antidepressant medications that work by increasing the levels of serotonin, also known as 5-hydroxytryptamine, or 5-HT, in the brain. Serotonin is a neurotransmitter that plays a crucial role in mood regulation, emotional processing, and cognition. It also has effects on other physiological functions such as sleep, appetite, and gastrointestinal motility. By selectively inhibiting the reuptake of serotonin at the synaptic cleft, SSRIs enhance serotonergic neurotransmission, which is believed to improve mood and reduce symptoms of anxiety and depression. Historical background of SSRIs. The development of SSRIs can be traced back to the mid-20th century when scientists began to recognize the role of neurotransmitters in mental health. Before SSRIs, the primary pharmacological treatments for depression were tricyclic antidepressants, or TCAs, and monoamine oxidase inhibitors, or MAOIs. While these drugs were effective, they had significant drawbacks, including severe side effects and a high risk of toxicity, particularly in overdose. Fluoxetine, the first SSRI, was discovered by Eli Lilly researchers in the 1970s and was approved for clinical use in 1987 under the brand name Prozac. The introduction of fluoxetine revolutionized the treatment of depression because it was not only effective but also had a much better safety profile compared to TCAs and MAOIs. Unlike TCAs, which affect multiple neurotransmitter systems, SSRIs selectively target serotonin, reducing the risk of side effects such as sedation, orthostatic hypotension, and cardiac toxicity. The success of fluoxetine led to the development of other SSRIs, including Sertraline, Paroxetine, Escitalopram, Escitalopram, and fluvoxamine. Today, SSRIs are among the most commonly prescribed psychiatric medications worldwide. Clinical indications for SSRIs. SSRIs are primarily used in the treatment of major depressive disorder, or MDD, and generalized anxiety disorder, or GAD. However, the use extends to a variety of psychiatric and non-psychiatric conditions. Let's discuss some of the key indications for SSRIs in clinical practice. First, major depressive disorder is the most common condition for which SSRIs are prescribed. They are considered first-line therapy due to their efficacy, tolerability, and lower risk of overdose compared to TCAs. SSRIs are also widely used for generalized anxiety disorder, panic disorder, and social anxiety disorder. Patients with panic disorder often experience sudden episodes of intense fear accompanied by physical symptoms such as palpitations, sweating, and shortness of breath. SSRIs can help reduce the frequency and severity of these panic attacks. Another important indication for SSRIs is obsessive-compulsive disorder, or OCD. Unlike depression, which often responds to standard doses of SSRIs. OCD typically requires higher doses and a longer duration of treatment to achieve therapeutic benefits. Fluoxetine, Sertraline, fluvoxamine, and paroxetine are commonly used for OCD. Post-traumatic stress disorder, or PTSD, is another condition where SSRIs are commonly prescribed. They help alleviate symptoms such as hypervigilance, intrusive thoughts, and emotional numbness. SSRIs are also used in premenstrual dysphoric disorder, or PMDD, a severe form of premenstrual syndrome characterized by significant mood disturbances, irritability, and physical symptoms. Fluoxetine and sertraline are among the most effective treatments for PMDD, and interestingly, they can be prescribed either continuously or only during the luteal phase of the menstrual cycle. In addition to psychiatric conditions, SSRIs are sometimes used for non-psychiatric indications. For example, they are prescribed for irritable bowel syndrome, or IBS, particularly in patients with predominant diarrhea and anxiety-related symptoms. They have also been used for chronic pain conditions such as fibromyalgia, diabetic neuropathy, and migraine prophylaxis. Mechanism of action of SSRIs. The primary mechanism of action of SSRIs is the inhibition of the serotonin transporter, or SERT, which prevents the reuptake of serotonin into the presynaptic neuron. This results in an increased concentration of serotonin in the synaptic cleft, prolonging its action on postsynaptic receptors. The enhanced serotonergic transmission is believed to improve mood, reduce anxiety, and alleviate other symptoms of depression. Unlike TCAs, which also affect norepinephrine and histamine receptors, SSRIs are highly selective for serotonin, making them more tolerable and reducing the risk of side effects such as sedation and weight gain. However, SSRIs are not without the drawbacks. One important consideration is that the therapeutic effects are not immediate. Most patients require at least 2 to 4 weeks before experiencing noticeable symptom relief. This delay is thought to be related to neuroadaptive changes, including increased neuroplasticity and alterations in receptor sensitivity. Adverse effects of SSRIs. While SSRIs are generally well tolerated, they are associated with several side effects. The most common include gastrointestinal symptoms such as nausea, diarrhea, and dyspepsia. These symptoms often improve with continued use. Central nervous system effects such as headache, dizziness, and insomnia are also frequently reported. Some patients experience increased anxiety during the initial weeks of treatment, which can be mitigated by starting at a lower dose and gradually titrating upwards. One of the most significant adverse effects of SSRIs is sexual dysfunction. This includes decreased libido, difficulty achieving orgasm, and erectile dysfunction. These side effects can be particularly distressing and are a common reason for treatment discontinuation. Another important side effect is weight changes. While fluoxetine is more likely to cause weight loss initially, other SSRIs such as paroxetine are associated with weight gain over long-term use. A rare but serious complication of SSRIs is serotonin syndrome, which occurs when excessive serotonin accumulates in the central nervous system. Symptoms include agitation, confusion, hyperreflexia, clonus, autonomic instability, and hypothermia. Serotonin syndrome is most commonly seen in patients taking multiple serotonergic agents, such as SSRIs combined with monoamine oxidase inhibitors, tramadol, or St. John's wort. Commonly prescribed SSRIs and the dosages. Fluoxetine, or Prozac, is often used for depression, OCD, and bulimia. It has a long half-life, reducing the risk of withdrawal symptoms. The typical starting dose is 20 mg per day, which can be increased up to 60 mg. Sertraline, or Zoloft, is used for depression, anxiety, PTSD, and OCD. It has a moderate half-life and a relatively favorable safety profile. The starting dose is usually 50 mg per day, with a maximum dose of 200 mg. Paroxetine, or Paxil, is used for depression, anxiety, and PTSD. It has a short half-life and is associated with significant withdrawal symptoms if discontinued abruptly. The usual dose ranges from 20 to 50 mg. Escitalopram, or Lexapro, is considered one of the most selective SSRIs and is used for depression and generalized anxiety disorder. The typical dose is 10 to 20 mg per day. In conclusion, SSRIs have revolutionized the treatment of mood and anxiety disorders. They are highly effective and generally well tolerated, but they are not without risks. Understanding their mechanisms, indications, and side effects is essential for their safe and effective use. Thank you for your attention, and I hope this lecture has provided you with a thorough understanding of SSRIs.